Harold was 67 years old. He had spent 30 years as a postal worker, walking 6 miles a day through rain and heat and everything in between. If anyone's feet were tough, it was his. So when he sat on the edge of his bed one Tuesday morning and noticed something he had been looking at for months, he did what most people do. He explained it away. 3 weeks later, his doctor told him he had been living with diabetes for at least 4 years. Not a new diagnosis. 4 years. And the signs had been sitting right there in his feet the whole time, quiet and invisible and easy to ignore. If you are over 60, your feet may be sending you the same message right now. The most dangerous part is that none of it hurts. Over the next several minutes, you will learn 9 specific changes that show up in the feet before any blood test confirms diabetes, and why catching them now could change everything. My name is Dr. Ethan Kent, and I have spent over 2 decades watching diabetes do its quiet damage long before most patients ever suspect it is there. In that time, the patients I worry about most are not the ones who come in scared. They are the ones who come in late. They walked fine, felt fine, and had no idea anything was wrong. What they had in common was this: the clues had been in their feet for years. According to the CDC, roughly 1 in 5 people living with diabetes does not know they have it. Today, I am going to walk you through 9 signs, what each one means inside your body, and what you can do about it. One patient, Margaret, 64, came in for a routine visit last year. She was active, healthy-looking, no obvious risk factors. Her feet showed 3 of these signs. Her A1C told us she had already crossed from prediabetes into type 2. The first sign is one she had noticed but never once connected to her blood sugar. Most people who have this sign say the same thing when you ask them about it. My foot falls asleep sometimes. I probably had my legs crossed too long. Or they blame their shoes. Too tight, too old, too narrow. They wiggle their toes, wait a few minutes, and move on with their day. What they do not know is that their body is not sending a signal about their shoes. It is sending a signal about their blood sugar. When glucose stays too high for too long, it slowly damages the protective coating around the nerves in your feet and legs. Think of the wiring inside an old lamp. The copper wire still runs through the middle, but the rubber insulation around it has started to crack and wear down. The electrical signal gets disrupted. It flickers. It misfires. That is exactly what is happening inside the feet of someone in the early stages of diabetic nerve damage. The tingling, the buzzing, the strange pins and needles that come and go, that is a damaged nerve trying to do its job with a coating that no longer protects it properly. The American Diabetes Association reports that close to half of all people with diabetes will develop some form of nerve damage in their lifetime, and in many cases, it begins in the feet long before any other symptoms appear. What starts as occasional tingling does not stay occasional. Over time, without intervention, those nerves stop sending incomplete signals and start sending none at all. That is when the real danger begins, because feet that cannot feel pain cannot warn you when something is wrong. Tonight, before you get into bed, take off your shoes and socks and sit somewhere with good light. Run your fingers slowly across the tops and bottoms of both feet. Press gently in different spots. Notice whether any area feels duller on one foot than the other, or whether you have to press harder in some places to feel anything at all. You are not looking for dramatic numbness. You are looking for unevenness, any spot that responds differently than it should. If you find one, write it down and pay attention to whether it is still there tomorrow. That single habit, done consistently, can catch a change that would otherwise go unnoticed for months. One of the most common things people say in the exam room when you point this out is that they have always been a slow healer. Their mother was the same way. It is just how their body works. They are not concerned. They have never been concerned. And that is exactly what makes this sign so easy to miss for so long. When blood sugar runs high over months and years, it thickens the blood and damages the walls of the small vessels that carry it. Those small vessels are the ones responsible for delivering white blood cells to the site of an injury, the cells that fight infection and rebuild damaged tissue. When they are compromised, that delivery slows down dramatically. Picture a city where there has been a major accident on the main road. The ambulances and fire trucks are on their way, but traffic is backed up for miles. The help exists, it just cannot get there fast enough. That is what is happening beneath the skin every time a person with uncontrolled blood sugar gets a small cut or a blister on their foot. The CDC has noted that diabetic foot ulcers affect a significant portion of people with diabetes at some point in their lives, and that these wounds are responsible for the majority of diabetes-related hospitalizations in the United States. What begins as a blister from a new pair of shoes or a small nick from a toenail clipped too short can stay open for weeks, then months, without adequate circulation delivering the right cells at the right time. The wound cannot close the way it should. A minor cut that a healthy body would seal in a few days becomes a chronic ulcer that opens the body to serious infection. This one asks for a simple daily habit that takes less than 2 minutes. Every evening, sit down in good light, not a dim bedroom, but somewhere you can actually see, and look at both feet completely. Check between the toes, along the heels, and around any bony areas where shoes tend to rub. If you find a spot that is cracked or raw, apply a thin layer of petroleum jelly and cover it loosely. It costs almost nothing and keeps the skin from drying and splitting further. More importantly, start counting. If any open spot is still there after 3 days without clear signs of closing, that is not slow healing. That is a warning. Write down when you first noticed it and bring that information to your doctor. 3 days is the line. Do not wait for it to get worse before you act. Everything covered so far has been uncomfortable to think about. This next sign is different. This is where the conversation moves from uncomfortable to genuinely dangerous, and it is important that you hear this one carefully. Most people assume that if something is seriously wrong with their body, they will feel it. Pain is the body's alarm system. It is how you know to pull your hand back from a hot stove or to stop walking on an injured ankle. But in someone whose nerves have been damaged by years of high blood sugar and whose small blood vessels can no longer deliver an adequate supply of oxygen and healing cells, both systems can fail at the same time. The alarm stops working, and the repair crew cannot get through. So a wound sits open on the bottom of a foot, or between 2 toes, or along a heel, and the person walking around on it feels absolutely nothing. No pain, no throbbing, no signal of any kind that something is wrong. Think of a road where there has been a collapse. The emergency alert system that was supposed to warn drivers is down, and the repair trucks that were supposed to fix the road are stuck on the other side of the blockage. Nothing gets in, nothing gets out. The damage just sits there, getting worse. This is not a rare or extreme scenario. Diabetic foot complications are the leading cause of non-traumatic lower limb amputations in the United States. Not accidents, not injuries, diabetes. And in the overwhelming majority of those cases, the wound was present long before anyone knew it was there, because it never hurt enough to demand attention. A painless open wound on your foot is a medical emergency, dressed in ordinary clothing. It does not look dramatic. It does not feel like much. That is precisely what makes it so dangerous. It is the kind of thing a person can walk past in the shower for 2 weeks without giving it a second thought. The rule here is simple, and it is not negotiable. If you find a wound on your foot that is open and causes you little or no pain, you have 48 hours. Not until your next scheduled appointment, not until the end of the week. If that wound is not clearly improving within 48 hours, meaning it is visibly smaller, cleaner, and beginning to close, you call your doctor that same day and describe exactly what you are looking at. Tell them it is open. Tell them how long it has been there. And tell them it does not hurt. Those 3 details together will tell your doctor everything they need to know about how quickly they need to see you. This next sign is sitting in plain sight on the body of many people who are watching this video right now. It has probably been there for months, maybe longer, and almost everyone who has it has already decided they know exactly what it is. Sun damage from years spent outdoors, age spots, just the skin doing what skin does when you get older. It looks familiar enough that it never raises an alarm, and that familiarity is exactly what makes it dangerous. When blood sugar remains elevated over a long period of time, the small vessels responsible for carrying oxygenated blood to the surface of the skin in the lower legs begin to narrow and weaken. The skin cells sitting at the far end of that delivery route start receiving less and less of what they need. Over time, they begin to change. The skin darkens in patches. It can take on a brownish or reddish tone. It may look leathery or slightly thickened in places. It is not sun damage. It is not a pigmentation quirk. It is the visible result of tissue that is being slowly undersupplied. Think of a delivery truck that runs a long route with many stops. The stops closest to the warehouse get their supplies first and most reliably. But the last stop on the route, the one furthest away, starts getting less and less, and eventually the truck stops making it there at all. The lower legs and feet are that last stop. They are the furthest point from the heart, and they are the first place the body's circulatory struggles show up on the skin. Research has shown that these kinds of skin changes in the lower extremities can appear years before a formal diabetes diagnosis is ever made. That means for many people, their skin has been trying to communicate something their blood work had not yet confirmed. The sign was there first. It just was not being read correctly. You do not need equipment or a gym membership to respond to this one. Tonight, while you are sitting and watching television, do 3 sets of ankle circles. Lift both feet slightly off the floor. Rotate them slowly in one direction 10 times, then the other direction 10 times. That is 1 set. 3 sets takes less than 5 minutes and costs nothing. It encourages blood to move through the exact vessels that are being compromised, stimulates circulation in the lower legs, and is gentle enough for anyone regardless of fitness level. If you have been looking at darkened or discolored patches on your lower legs and writing them off as something minor, look again. Your skin may have been giving you a 4-year head start on a diagnosis that has not arrived yet. Every winter, millions of people reach for a thicker lotion and assume that is the end of the conversation. The skin on their feet is dry and cracked. The air is cold. And that combination has always explained it well enough. Some people blame age. Some people say their skin has just always been on the dry side. They moisturize for a few days, see a little improvement, and move on. What most of them do not realize is that for some people, the dryness has nothing to do with the weather or the season. It is coming from the inside. The autonomic nervous system controls many of the body's automatic functions, things that happen without you thinking about them. One of those functions is the activity of the sweat glands in the feet. When high blood sugar damages the autonomic nerves over time, those sweat glands begin to shut down. The feet stop producing the natural moisture that keeps skin supple and intact. No amount of lotion fully compensates for a system that has stopped working from within. Think of a building where the internal humidity system has been completely disconnected. You can spray water on the walls all you like, but without the system running inside, the structure keeps drying out. The surface fix does not address the internal failure. The American Podiatric Medical Association has identified autonomic neuropathy as a significant contributing factor to chronic dry skin and fissuring in diabetic patients, noting that this type of skin breakdown is one of the earliest and most overlooked entry points for serious foot infection. A crack in the heel may look like a cosmetic problem, but skin that has split open is no longer an intact barrier. Bacteria does not need a large opening. It needs any opening at all. A deep heel fissure in someone with compromised circulation and reduced immune response at the feet is a combination that can escalate faster than most people expect. The habit change here works on two levels. Every night before bed, apply a moisturizer to the heels and soles of both feet, not between the toes, because trapped moisture in that area creates its own set of problems, including fungal infection. Use a lotion that contains urea or lactic acid if you can find one, as both help the skin hold water more effectively than basic creams. The second part of this habit is internal. Drink a glass of water before bed, not just with meals. Most people are mildly dehydrated by evening without realizing it, and chronically dry skin is partly a reflection of that. Lotion on the outside and water on the inside every night is a simple combination that costs almost nothing and begins protecting the skin barrier that stands between your foot and a serious infection. Before we continue, I want to ask you something directly. Have you noticed any of these signs in yourself or in someone you love? You do not need to write a paragraph. One word in the comments is enough. I read every single one. This channel exists for one reason: to give you the information that a 15-minute doctor's appointment almost never has time to cover. If this video is helping you, please hit the like button. Now, let's keep going, because the next 4 signs are ones most people have never connected to blood sugar at all. Most people have experienced swollen feet at the end of a long day. You were on your feet for hours, or you sat through a long car ride, or the summer heat just got to you. You put your feet up, you sleep, and by morning everything is back to normal. That kind of swelling is common, and it is not what we are talking about here. The sign that matters is the swelling that is still there when you wake up, the kind that greets you before you have even taken a single step. When blood sugar stays elevated over a long period of time, it begins to affect the kidneys. The kidneys are responsible for filtering waste and excess fluid from the blood and moving it out of the body. When that filtering process becomes less efficient, fluid that should be processed and removed starts to build up instead. And because of the way gravity works, that fluid settles at the lowest point it can reach, the feet and ankles. Think of a drainage system in a building where the main filter has become partially blocked. Water keeps coming in, but it cannot move through fast enough. It backs up. It pools. It sits.
The National Kidney Foundation has reported that diabetes is the leading cause of kidney disease in the United States, and that kidney function can begin to decline quietly for years before it shows up clearly on a standard lab panel. That means swelling in the feet and ankles may be reflecting a kidney problem that has not yet been formally identified. It is not just a circulation issue. It is the body's filtration system struggling to keep up, and the feet are where that struggle becomes visible first. Two habits apply directly to this sign. The first is elevation. Before you go to sleep each night, lie down and prop both feet up above the level of your heart for at least 20 minutes. This encourages the fluid that has pooled during the day to move back into circulation, where the body can process it. A couple of firm pillows under the ankles works perfectly well. The second habit is sodium. Most people consume the bulk of their sodium in the evening, in sauces, soups, processed foods, and restaurant meals. Sodium tells the body to hold on to water. Reducing your evening sodium intake, even modestly, can make a noticeable difference in how your feet look and feel by morning. And here is the line you need to remember. If you wake up on 3 consecutive mornings and your feet or ankles are still swollen before you have been on your feet at all, do not wait for your next scheduled appointment. Call your doctor and describe exactly what you are seeing. Morning swelling that does not resolve overnight is not a minor inconvenience. It is your body asking a question that needs a real answer. A large number of people who have this sign have already been told what it is. Arthritis, plantar fasciitis, an old injury that never healed quite right. They have been managing it with ibuprofen for months, sometimes longer, and because the pain comes and goes, that explanation has always felt like enough. To be fair, those causes are sometimes exactly right. Arthritis is real. Plantar fasciitis is real. Old injuries do linger. But there is a pattern that shows up in the exam room with enough regularity that it deserves its own conversation. The patient who has been treating the wrong thing for a very long time. When blood sugar damages the nerves in the feet over an extended period, those nerves do not always go quiet. Sometimes they go haywire. They begin firing pain signals continuously, even when there is no injury, no inflammation, and no physical reason for the pain. The burning, the shooting sensation that travels up through the arch or along the toes, the feeling of walking on hot sand, even in a cool room. None of that is coming from a structural problem in the foot. It is coming from a nervous system that has been damaged and is now misfiring. Think of a fire alarm that has been wired incorrectly. It goes off at random. There is no smoke, no fire, no threat of any kind. But the alarm does not know that. It just keeps triggering. Research published in leading medical journals has shown that neuropathic pain is one of the most frequently misdiagnosed conditions in primary care, with a significant number of patients receiving treatment for musculoskeletal causes for a year or more before the underlying nerve damage is identified. That delay matters enormously. Every month spent treating the symptom with pain medication rather than addressing the blood sugar driving the nerve damage is another month the damage continues to progress underneath. The pain is not the problem. The pain is the signal. Masking it without investigating its source is like pulling the battery out of that misfiring alarm and going back to sleep. The habit close for this sign is simple and takes 2 minutes at each end of the day. When you first get out of bed in the morning, before you put any weight on your feet, sit on the edge of the bed and spend 1 minute doing slow, gentle toe curls and ankle flexes. Point the foot away from you, then pull it back toward you, 10 times each. Do the same thing at night before you lie down. This keeps the tendons and small muscles in the feet mobile, supports circulation through the exact areas where nerve damage tends to develop, and gives you a quiet daily moment to notice whether the sensation in your feet has changed in any way since the day before.
Cold feet is one of those complaints that almost everyone has a ready explanation for. It has always been that way. The house runs cold. The circulation has never been great. A spouse jokes about it every night. It becomes part of the personal story a person tells about themselves, and once something becomes part of that story, it stops being examined.
But there is a question worth asking, and it is a simple one. Are your feet cold in July? Are they cold when you are already under 3 blankets? Because that is a different conversation entirely. When blood sugar stays elevated over many years, it triggers a process called glycation, where sugar molecules attach themselves to the proteins that make up the walls of the arteries. Over time, those walls become stiffer and narrower. Blood that is supposed to flow freely through them meets increasing resistance. The further from the heart, the harder it becomes to push an adequate supply of warm, oxygenated blood all the way to the destination. The feet and toes are at the end of a very long route, and when the pipes have stiffened, the warmth simply cannot get there. Think of a home heating system trying to push hot water through a network of pipes where the far end has become partially blocked and rigid. The rooms closest to the boiler stay warm. The room at the end of the line stays cold no matter how high you turn up the heat. The American Heart Association has reported that peripheral artery disease, which is the narrowing of the arteries that supply blood to the limbs, affects more than 8 million people in the United States, with significantly higher rates among people with diabetes and adults over 60. Many of them describe chronically cold feet as one of the first things they noticed, often years before any formal diagnosis was made. The most direct response to this sign is also one of the most well-supported habits in all of cardiovascular research: a daily walk. It does not need to be fast. It does not need to be long. 10 minutes at a comfortable pace once a day encourages the body to develop and maintain smaller secondary blood vessels that support circulation in the legs and feet. It creates demand that the vascular system responds to over time. If walking outside is not yet accessible to you, seated marching works as a genuine alternative. Sit upright in a firm chair. Lift one knee at a time in a slow, steady marching rhythm for 10 minutes. It engages the same muscle groups, drives circulation through the lower legs, and can be done in any room at any time of day. Start today, not next week. The vascular system responds to consistency, and 10 minutes done daily is worth far more than an hour done occasionally. This last sign is the one that almost nobody is talking about. It is not in most patient brochures. It does not come up in the average doctor's appointment. And because it is painless, silent, and easy to overlook in the shower or while getting dressed, most people who have it have walked past it every single day without a second thought. That is exactly why it belongs on this list. Hair follicles are small structures, and like every other living part of the body, they depend on a steady supply of blood to function. The vessels that serve them in the lower legs and feet are among the smallest in the entire circulatory system. When blood sugar has been elevated for an extended period, those tiny vessels narrow and weaken. The follicles at the end of that supply line start receiving less and less of what they need. They do not die suddenly. They simply stop producing. The hair on the lower legs and the tops of the feet gradually thins out and disappears, often so slowly that the person never notices it happening. Think of a garden fed by an irrigation line that has been slowly narrowing over several seasons.
The plants closest to the water source stay healthy, but the ones at the far end of the line get less and less water over time. They do not wilt dramatically, they just stop growing. They stop putting out new leaves. And eventually, if you look carefully, you notice that the far end of the garden looks different from the rest.
That is what is happening to the hair on the lower legs of someone whose microvascular circulation has been quietly compromised. This is not a sign that patients typically report. It is a sign that trained clinicians look for. During a formal diabetic foot examination, checking for the absence of hair on the lower legs and the tops of the feet is a standard part of the assessment, precisely because it reflects the condition of the small blood vessels that cannot be seen from the outside any other way.
So here is what I want you to do right now. Not later, not tonight, right now. Pull up your trouser leg and look at your lower leg and the top of your foot. Is there hair there? Is it significantly thinner than it used to be, or than it is on other parts of your body? If the answer gives you pause, that is worth paying attention to. Everything covered in this video, all 9 signs, can be confirmed or ruled out with a single blood test. A fasting blood glucose test costs around $12 at most labs and requires no referral in many places. $12. That is the price of knowing. And knowing, even when the answer is difficult, is always better than the alternative. Every patient I have seen who came in later than they should have had one thing in common, and it was not carelessness. It was not laziness. It was not that they did not care about their health. They came in late because nobody had ever sat them down and shown them what to look for. Nobody had connected the dry skin to the nerve damage, or the cold feet to the narrowing arteries, or the missing hair to the failing vessels underneath. The information simply was not in front of them. Until now. You came into this video the same way most people do, not knowing what you did not know. You are leaving it with something real. 9 specific signs, the biology behind each one, and a clear picture of what to do next. That is not a small thing. Knowledge at the right moment has the power to change outcomes, and you now have exactly that. Let's talk about your next step. Tonight, before you go to bed, sit down in a good light, take off your shoes and socks, and spend 30 seconds looking at your feet. Check for everything covered in this video: numbness, slow healing spots, discoloration, dryness, swelling, missing hair. 30 seconds. If anything matches, do not put it on a mental list for someday. Call your doctor tomorrow. And this week, get the fasting blood glucose test. $12. 1 appointment. 1 answer. If this video gave you something useful, share it with one person tonight. Send it to a sibling, a close friend, or a neighbor over 60 on WhatsApp. You will not be sending them a scare. You will be giving them a head start they did not know they needed. If you want more videos like this one, subscribe to this channel. Every week, we cover the health information that rarely makes it into a short doctor's visit, but belongs in every senior's hands. This is Dr. Ethan Kent. Catching it early changes everything. Take care of those feet.